Daniel, the care partner, is a vital team member in the CAR T process. Can you explain the role of a care partner?
Absolutely. I think one of the key ingredients, I think, in cancer care across the board is the caregiver. I think many times it's forgotten because we're very focused on the patient's needs, but entirely it's not just the patient who has the cancer, it's the caregiver who actually has the cancer or bears some of the burden. So I think it's important to always have them involved in all of the roles and each step that the patient goes through, and also try to provide them support that they may need that's extra, not that the patient gets.
Yeah. As a nurse practitioner, Daniel, you educate care partners about the CAR T cell process. What are three key pieces of advice you share with care partners for patients who are considering CAR T cell therapy?
There's a few, so big three key points to this is that it's a journey. One of the things, it's not just a quick, we're going to do this in a month and then we'll be moving on. It's going to be for a couple of months or a few years that we may be together during this CAR T experience. One, there's going to be also many trips to your facility, your institution, your cancer center that are required to even getting part of the CAR T, working up for the CAR T before even having the cells manufactured and given back to them. And I think also having an extra support for them. So the caregiver also has to have support outside of them. So if they're not able to make them a meeting or come to an appointment, they should have a backup or somebody even just to talk to outside of just the cancer center.
For care partners, what support and resources do you recommend for their mental and physical well being when caring for a loved one who's undergoing CAR T?
Absolutely. I think you could even broad span that to all of cancer care itself, but especially with CAR T, there's many resources out there that are available. So the International Myeloma Foundation, the Multiple Myeloma Research Foundation has many resources online. We do have our own BMT coordinators as a secondary support in our institution. I'm not Mr. Dr. Google, so I always tell them to go to those two IMF or the MMRF websites for those. And then reaching out to support groups, being part of support groups that so they know others have gone through it and what they've experienced, and using tips that they may have done differently that makes them get through it. I always say, I've not experienced it. I can tell you what my patients have told me, but I think it's always fantastic to hear it from the person or the caregiver that's lived it.